1. A Certified Diabetes Educator (CDE) aims to empower clients by helping them develop self-management strategies. Which teaching approach best supports this goal? A. Lecture-based instruction. B. Problem-solving and motivational interviewing. C. Memorization of glucose targets. D. Rigid adherence to scripted education sessions. 2. When developing a diabetes education curriculum for adults, which principles should guide lesson planning? A. Focus primarily on complex medical terminology. B. Emphasize learner experience and self-direction. C. Deliver information in a one-way lecture format. D. Require all learners to follow identical plans. 3. During an evaluation of a client's understanding of insulin administration, what is the most effective assessment method? A. True-false written test. B. Direct observation with return demonstration. C. Group discussion feedback. D. Multiple choice quiz. 4. A diabetes educator notices that a patient struggles with carbohydrate counting. What should the educator do first? A. Reprimand the patient for non-compliance. B. Assess the patient's numeracy and literacy level. C. Simplify the entire education program. D. Refer immediately to a dietitian. 5. Which component is essential in curriculum development for diabetes education? A. Random selection of topics. B. Clearly stated behavioral learning objectives. C. Focus only on pharmacologic treatments. D. Avoidance of cultural considerations. 6. A client reports hypoglycemia during exercise. What teaching strategy best supports adult learning and safety? A. Provide written materials only. B. Discuss prevention strategies using real-life scenarios. C. Deliver a lecture on physiology. D. Delay education until next appointment. 7. When evaluating program effectiveness, which tool provides the most reliable measure of patient behavior change? A. Verbal self-reporting. B. Structured follow-up assessment. C. Pre- and post-program surveys. D. Random interviews. 8. To ensure communication compliance, the CDE must follow HIPAA regulations by A. Sharing patient data freely within the team. B. Discussing cases in public spaces. C. Protecting all identifiable health information. D. Using unsecured email for follow-ups. 9. Which mentoring approach promotes professional growth among new diabetes educators? A. Directive supervision. B. Collaborative coaching and reflective dialogue. C. Observation without feedback. D. Task-based delegation only. 10. When teaching blood glucose monitoring to older adults, the educator should primarily A. Use small font instructional materials. B. Incorporate hands-on practice with large print visuals. C. Provide detailed pharmacology lectures. D. Focus on advanced device calibration. 11. Which step ensures validity in evaluating diabetes education outcomes? A. Matching assessment methods to learning objectives. B. Using the same test for all learners. C. Relying on anecdotal success stories. D. Ignoring cultural differences in response. 12. To support adult learners, educators should A. Assume prior knowledge without verification. B. Connect new information to existing experiences. C. Focus on rote memorization. D. Limit questions to end of session. 13. A curriculum is being revised to align with ADA standards. This update represents A. Program evaluation and regulatory compliance. B. Instructor preference changes. C. Learner-driven adjustment only. D. Unnecessary modification. 14. When documenting patient progress, which approach best maintains legal and professional standards? A. Write minimal notes to save time. B. Record objective findings and outcomes accurately. C. Include personal opinions about patient behavior. D. Summarize verbally without documentation. 15. What best demonstrates formative evaluation in diabetes education? A. Conducting ongoing feedback sessions during the course. B. Administering a final post-test only. C. Measuring A1C after program completion. D. Comparing group averages annually. 16. A patient demonstrates insulin injection incorrectly. The educator should ignore minor errors. B. Provide corrective feedback and supervised repractice. C. Reassign another educator. D. End the session early. 17. To ensure cultural competence, the diabetes educator should A. Use standardized teaching for all patients. Integrate cultural beliefs into education plans. C. Avoid discussing food customs. D. Focus only on medical facts. 18. Which technique enhances motivation for behavior change in diabetes self-care? A. Imposing strict rules. B. Goal setting and self-monitoring strategies. C. Using punishment for missed goals. D. Limiting discussion on barriers. 19. Which aspect of communication is most critical in patient-centered diabetes counseling? A. Active listening and empathy. B. Frequent use of medical jargon. C. Dominating the conversation. D. Ignoring patient emotions. 20. When creating an evaluation tool for a diabetes education program, what should be prioritized? A. Alignment with learning objectives. B. Length of the survey. C. Complexity of the questions. D. Appearance of professionalism. 21. A CDE develops an online module to teach foot care. What principle ensures accessibility for all learners? A. Using only text-based slides. B. Incorporating interactive multimedia and captions. C. Excluding visual learners. D. Avoiding demonstrations. 22. When mentoring a new educator, which feedback approach is most effective? A. Immediate, specific, and balanced feedback. B. Annual performance review only. C. General praise without examples. D. Criticism during group meetings. 23. To promote long-term behavior change, diabetes education should A. Focus solely on information delivery. B. Integrate behavior modification techniques. Minimize goal-setting exercises. D. Avoid patient input. 24. When developing a diabetes education module for visually impaired patients, what instructional approach best supports accessibility? A. Use of audio recordings and tactile models for demonstrations. B. Reliance on printed charts and visual graphs. C. Limiting instruction to written handouts. D. Assigning a caregiver to interpret all materials. 25. When developing learning objectives, what should each objective include? A. Observable and measurable outcomes. B. General intentions. C. Broad mission statements. D. Complex medical definitions. 26. The CDE notices that educational outcomes vary widely across participants. What steps should be taken? A. Review and adjust teaching strategies and materials. Continue without changes. C. Blame patient noncompliance. D. Reduce program duration. 27. Which adult learning theory emphasizes self-direction and experience-based learning? A. Behaviorism. B. Andragogy. C. Constructivism. D. Cognitive load theory. 28. During group sessions, conflict arises among participants. What is the best educator response? A. Ignore the conflict. B. Use active facilitation to refocus on shared goals. C. Dismiss participants causing disruption. D. End the session immediately. 29. To meet accreditation standards, diabetes education programs must demonstrate evidence-based practice and evaluation. B. Focus solely on patient satisfaction. C. Eliminate pre-assessment requirements. D. Use only instructor preference content. 30. Will best define summative evaluation in diabetes education? A. Assessing learner performance at program completion. B. Gathering ongoing feedback mid-session. C. Evaluating educator performance only. D. Informal classroom observation. 31. When communicating lab results to patients, educators should A. Use simple, clear language free of jargon. B. Quote technical data without interpretation. C. Provide written data only. D. Avoid discussing test results directly. 32. A CDE identifies inconsistencies in patient documentation among staff. The appropriate action is to A. Offer a mentoring session on documentation standards. B. Ignore minor discrepancies. C. Delegate corrections to administrative staff. D. Avoid addressing the issue. 33. What is the primary ethical responsibility of a diabetes educator? A. Promote patient autonomy and evidence-based care. Prioritize institutional policy over patient needs. C. Limit patient decision-making. D. Focus solely on physician directives. 34. A new educator joins the diabetes care team and lacks experience with electronic health records, EHRs. What mentoring approach should a senior CDE take? A. Provide step-by-step guided practice sessions. B. Assign full data entry responsibility immediately. C. Offer minimal support to encourage independence. D. Focus mentoring solely on clinical instruction. 35. During a post-program evaluation, data show improved knowledge but no behavioral change in patients. What should the educator do next? A. Revise the curriculum to include motivational and behavioral interventions. B. Continue the same program without modification. C. Focus evaluations solely on knowledge gains. D. Increase the program's technical content